Hello everyone, my name is Zhou Jingyi and I am a doctor. Before we dive into today's report, I'd like to share that my perspective comes from years of experience in China's medical research centers before transferring to a general hospital here in Japan. I've seen how data saves lives, but also how it can be misused. Did you know that an abnormal situation is currently occurring in the American medical community that is shaking our privacy? Secretary Robert F. Kennedy Jr. was appointed head of the U.S. Department of Health and Human Services under the Trump administration. Now it has been revealed that his team is working hard to gain access to the personal medical records of most Americans, or raw medical record data, causing a stir. The purpose is to investigate the relationship between vaccines and autism. Why is the top government now trying to intrude on people's privacy to collect data on an issue that the medical community has completely concluded that there is no relationship between the two? Today, we will take a look behind the scenes of this news and the truth behind the history of the vaccine conspiracy theory that still persists. I break down and explain specialized systems and past incidents using familiar examples so that the general public can easily imagine them. Well then, here you go. First, the surprising point of this news is the method of data collection. Secretary Kennedy's team turned to a system called the State-Run Health Information Exchange System, commonly known as HIE. This is a somewhat difficult word, but to put it simply, it is a network for local hospitals to share patient information. For example, when you are transferred from a local clinic to a large hospital, it would be convenient if you could share on your computer. What kind of illnesses did this patient suffer from, and what kind of medicines did he take? Even without a letter of introduction. This is the system for that purpose. Think of HIE like a secure digital port for the brain of the healthcare system. It allows critical information to dock where it's needed instantly, ensuring seamless care. But just like a physical port, access must be strictly controlled to prevent unauthorized boarding of your personal data. This site is packed with top-notch personal information, including vivid notes taken by doctors during examinations and the history of prescribed medications. An example would be a locked medical record cabinet that should never be shown to outsiders. Secretary Kennedy's team is now demanding that the entire locked medical record cabinet be shown to the government. In fact, private organizations in Nebraska have received millions of dollars in grants from the Centers for Disease Control and Prevention, CDC, to support this project, and demonstration experiments are underway. Public health experts and former CDC officials have been fiercely opposed to this. If you just want to analyze data, you should be able to use anonymized statistical data with names and addresses removed. Why are you so particular about raw data that can identify individuals? It's a violation of privacy. Some states, such as Maryland, clearly refuse to share data with the government. Privacy remains a paramount concern in the digital age of medicine, and the medical community is standing its ground against this unprecedented overreach. So why is Secretary Kennedy so obsessed with the relationship between vaccines and autism? That's because he is a representative figure of the so-called vaccine skeptics, who have long argued that vaccines are dangerous. With his slogan, "Make America Healthy Again," MAHA, he is intent on proving that vaccines are to blame for the rise in chronic disease in children. But let me be clear here. All specialized organizations around the world, including the World Health Organization, WHO, the US CDC, and Japan's Ministry of Health, Labor and Welfare, have all concluded based on vast amounts of data that vaccines and autism are completely unrelated. This isn't just an opinion, it's a global scientific consensus. But why has the rumor that vaccines cause autism remained so persistent around the world? The cause lies in a major crime committed by a doctor that occurred in 1998, more than 20 years ago. A single paper that changed the course of public health history. British doctor Andrew Wakefield published a paper in a prestigious medical journal stating that children who were vaccinated with the new three-way combination, MMR, vaccine developed autism. At that time, parents around the world panicked, vaccination rates plummeted, and many children died from preventable diseases. However, no matter how much research researchers around the world conducted, they could not find the same results. When journalists and academic societies became suspicious and investigated, shocking facts were discovered. The data simply didn't exist. It turned out that Wakefield had been fabricating data to suit his hypothesis. They distorted the number of children surveyed and completely fabricated the facts. It was also revealed that behind the scenes, he had received large sums of money from lawyers who were trying to sue vaccine companies. It was a calculated fraud for profit. In 2010, a medical journal retracted the paper, calling it completely wrong. Wakefield was stripped of his medical license and expelled from the medical community. This is the truth behind the world's biggest vaccine hoax. Despite this, the damage to public trust continues to echo through current politics. The paper that caused the accident was proven to be a lie, and the person who wrote it was no longer a doctor. So why do so many people, including Secretary Kennedy, still believe this? This is because there are two traps in human psychology that make it easy to believe this. Understanding these traps is the first step toward clarity. The first is the timing trap. The period when children receive a large number of regular vaccines, infancy, coincides exactly with the period when symptoms of autism, such as language delay and difficulty making eye contact, begin to become noticeable. It's a natural period of development. If your child got a vaccine yesterday and your child looks a little different today, you as a parent might think that it might be because of the vaccine. This is psychologically unavoidable, but it is not a scientific cause and effect relationship, but just a coincidence of timing. Like seeing stars because it's night, not because you turned off the lights. The second is changes in diagnostic criteria. I often hear the argument, there are more children with autism than ever before. It's all because of vaccines. However, the real reason for the increase is not the vaccine. We've simply become better at identifying the spectrum. This is because advances in medical science have made it possible to correctly diagnose and support mild symptoms, which in the past would have been dismissed as a quiet child with a bit of personality, as autism spectrum disorder. The number of diseases has not increased just because the way the denominator is counted has changed. It's about better support, not more illness. To ensure you are getting the facts, I always look to established journals like Nature, Science, JAMA, or NEJM. These are the gold standards where research must pass rigorous peer review. When we see headlines, we must ask, where is the raw data, and has it been verified by the international scientific community? Reliance on reputable institutions is our best defense against misinformation. Before I conclude, I must offer a clinical caution. While the science on vaccines is clear, medical science also teaches us that individual biological responses can vary based on factors like genetics or gut microbiota. Always consult with your primary healthcare provider for advice tailored to your specific health profile. Credibility begins with acknowledging the complexity of human biology. The current investigation that Secretary Kennedy is proceeding with is based on medically proven lies. This can be said to be a move that is putting the people's huge budget and precious privacy at risk due to strong personal beliefs and political appeals. That's why we experts are so critical. We must protect the integrity of our medical systems. The internet is full of words that can make parents anxious. However, rather than someone's strong assumptions, scientific evidence based on accurate data from tens of thousands of people is the only shield that can protect children's lives. It is our collective responsibility to demand truth based on evidence. In this age of information overflowing, let's work together to cultivate the ability to discern what is true. If you found this content helpful, please subscribe to the channel and give us a high rating. Let's build a healthier, better informed world together. See you again in the next video. It was Joe Jingi. Keep staying informed and healthy. Until next time.